Afternoon, sir.
Good afternoon, Santosh.
Yes, sir. Good afternoon, sir.
Good afternoon.
How are you, sir?
Fine, thank you. Fine, thank you.
I can hear you, sir.
I can hear your voice, but I can't see your face.
Yes, sir.
You have not put on your videos. Yeah, yeah.
Can you see me? Thank you, sir. Anil Sinha sir, I joined, sir.
You are looking very smart in your shirt and tie. I'm in Goa, sitting under fan.
Oh, I see.
So,
Oh, and here, sir, winter has set in.
but I know. I came only 3 days ago. I came on 19th. The winter was already there.
Oh.
But Goa is there's no sign of winter. We put on fans even in the evening.
Oh, very pleasant, sir.
Nice.
So far, 65 delegates have joined, sir. But panelists, other than you, we are missing all other panelists.
Do you mean to say that I will have to speak for 75 minutes?
There must be joining, sir. So how in Goa, sir?
It's not that bad. And North Goa is affected because North Goa is densely populated.
Oh.
I'm in South Goa. South Goa is very thinly populated. And my villa, the complex where I am there, it overlooks the sea. So, and there's hardly any population. So, this area, there is no effect whatsoever.
Okay. So, and when are you coming back to Delhi, sir?
I'll come back in the first week of February now, after winter is over.
Oh, I see. So you are gone for long. Yeah.
Almost 2.5 to 3 months.
Oh,
Last
very
year
good,
also
sir.
we spent entire summer in winter in Goa, because Delhi is becoming gradually unlivable in winter months.
Yes, yes, sir. That is
a few years
right,
ago,
sir.
whenever anybody asked me outside India, anybody asking me what is the best time to come to Delhi, I used to say November to February, because that used to be the pleasant months. Now, November to February is becoming unlivable.
It's a horrible, sir. It's you can't even take walk in the morning, or you can't go for school in the evening. And every is a weather, but the old existing harder than the COVID is the pollution.
Yeah. Winter, pollution, and COVID, 3 things combined together. Delhi is gradually becoming unlivable in winter months.
Right, sir. I think we should also plan on the way that you are planning, sir.
Good afternoon, Aliji. Good afternoon.
Good afternoon, sir. Welcome you, sir, here.
Yeah, namaskar.
Namaskar.
Good afternoon.
Sir,
Good afternoon, sir. Santosh.
Thank you, sir. Good afternoon, sir. I hope you are in Delhi, sir.
Yes. I'm very much at home. Yeah.
And we are waiting for now the Professor Menon and Mr. Muzaffar Rahman.
Okay.
I have a little doubt about Dr. Muzaffar, because Srinagar has very poor connectivity. As you know, I think 4G is still not given there.
But I was doing just a parallel meeting is going on in Jammu Kashmir, sir, for Jhelum and this flood recovery program. I am the member of the committee, and it was wonderfully connected, and no hassle, nothing, and everything is going on very well.
So let's hope he joins.
Hopefully, yes. बधाई सर आप लोगों को Belated. पूजा की बधाई
हाँ थैंक यू
और हो सर घर में सब लोग रिकवर कर गए कोविड से
या गॉड्स ग्रेस एवरीवन इज ओके यस
वेरी नाइस
आप लोग के घर में सब ठीक है
ब्लेसिंग्स ऑल वेल सर 100
डॉक्टर साहब ज्वाइन करेंगे
सो आई थिंक
हम लोग आपका इंतजार कर रहे हैं आप ज्वाइन करेंगे
start because 2 o'clock
अभी है couple of minutes I thought
okay ठीक है सर so 122 participants have joined so far
yeah that's a good number
yeah
and has Major Bindal joined General Bindal joined
sir he will not be able to join I had requested him but he got engaged somewhere else
oh okay
is Raka online Raka can you hear me
yes sir yes actually I am in talk with him Muzaffar sir is trying to join but it's difficult for him meanwhile I'm in contact with Vinod Menon sir and Muzaffar Ahmed sir and I'm trying that they can join
विनोद को तो प्रॉब्लम नहीं होना चाहिए
सर वो एक बार वो पैनलिस्ट से ज्वाइन मतलब पैनलिस्ट में भी नहीं आ पा रहे हैं वो आ जाएंगे he is trying
he is an
Raka
जी
while they are contacting the most important speaker Anil ji is here
sir I can see Anil sir I can see sir
and Anil ji is there and Sarva Gyan Sampann Santosh Kumar is here
so just give me another 2 minutes I'll talk to Vinod Menon sir and come back again
ठीक है
what do you suggest we should start now because 150 participants have joined already
so let us start
I think we should start
yeah they will join in meanwhile
they will join on the way sir so I would be requesting first to whom sir you will be speaking or Sinha sir
now first of all is there any introductory thing
sir yes
Raka, please start.
Okay, sir. Thank you. Let's start with the program today. And formally, a very good afternoon to all of you, our distinguished speakers, the guiding force actually. And along with that, also I extend my heartfelt thanks to all the participants here today in this afternoon. And also to our Executive Director, Mr. Kumar Bindal, who has been always a guiding force because of what we have been able to conduct such wonderful programs. And as all of you know that today's topic is a very important topic when we are undergoing an unprecedented situation regarding COVID-19. And that is actually risk communication and community engagement in fight against COVID-19. As all of us know that communication is key to community engagement in any sense of disaster. In any case of emergency, it's of utmost importance. And like, let me give you just a definition what actually crisis and emergency risk communication is. As per CDC, and Reynolds also, he's a very famous author about disaster and risk communication. They say that risk crisis and emergency risk communication is the efforts by experts to provide information to allow an individual, the stakeholders, or an entire community to make the best decision about the well-being within nearly impossible time constraints and help people ultimately to accept the imperfect nature of choices during the crisis. And that is actually about any emergency and disaster crisis situation. And when we talk about actually this risk communication and crisis communication, and specifically in terms of a pandemic, that is obviously an slow onset disaster, which takes a lot of time and it gives a lot of time to us so that we can continue, strengthen, and go ahead with our perfect nature, robust nature of crisis communication, and that is how we can expect the community to be prepared and ready. But unfortunately, worldwide, uh, this was lacking when we are talking about COVID-19. Worldwide, it was lacking. And now we can see that second wave of the third wave, whatever we are telling it, it's again started on the, it again have been started. And before that, we need to strengthen our this system, how the entire community has to be engaged, how the risk communication has to be robust. And that is in very much in line with our Honorable Prime Minister's Jan Andolan system, the Jan Andolan thing. And along with that, I will not take a lot of time. I was just introducing the topic in front of all of you. And now I would request Professor Santosh Kumar here. Professor, let me first introduce Professor Santosh Kumar. Professor Santosh is a senior professor in NIDM National Institute. Let me do, sir. Let me do it. You are muted, sir, actually. You are muted. Unmute yourself. Santosh, sir, still you are muted.
What
Your
I'm
voice
saying,
is not.
what
Yeah.
I'm saying, to introduce our guest rather than me.
Sir, actually, when I'll be inviting one by one to them, then I'll give an elaborate introduction about all of them. So right now I'm inviting you. So let me introduce you first, and after that
I will introduce my thank you. Thank you, Dr. Raka, and thank you good afternoon to everyone, especially first of all to Shri Ji and Shri Anil Sinha ji and Professor Vinod Menon, and we are waiting for Mr. Muzaffar Ahmad. All have been decorated very, very senior position in the disaster risk management. Sri Anil Sinha was the vice chairman of the Bihar State Disaster Management Authority, and long years of engagement in DRR, especially starting from the first kind of engagement as a collector in district Bar, which is called as a Bar. He always keep referring this. So from Bar to as a joint secretary to Ministry of Agriculture, where he was the heading this disaster management division, and the Gujarat earthquake took place and it got engaged himself. Then high powered committee, constitution of high powered committee, and he was the member secretary of the high powered committee. And so being a senior civil servant in the country and represented most of the this kind of disaster management institutions as the first executive director of NIDM, also when this was created in 2002, as a 96 to transition from NCDM to 90, this NIDM. So this is what we say, that very, very distinguished panel which we have. So I welcome Shri Anil Sinha Sahab in this very forum. And I also take this opportunity to welcome Shri Kem Singh Ji, that you all might be knowing. I always feel very, very kind of, we see that's a wonderful opportunity to introduce him, as he also been the recipient of Netaji Subhash Chandra National Award for Disaster Management, constituted by Government of India. for not only conceiving but raising a very good force, which which is known today as Angel in Orange, and so that is that he nurtured, and today Angel is everywhere. So the National Disaster Management Disaster Response Force, being the member of the National Disaster Management Authority, belonging from the Indian Police Service. Long years he has spent in Maharashtra and also in Jammu and Kashmir as a and also the DG of the CISF. I welcome you, sir, with your insights of different states and being very, very important and seeing this the communication, emergency communication with the police angle and also with the disaster perspective angle. We are very fortunate to have you also in this panel. So thank you very much for being with us today. We have another panelist, Professor Vinod Chandran Menon, who has been part of DRR at different places, working as an emergency communication officer in UNICEF, professor in Yashada, where this the first emergency communication center was established, and after that, the training and that things were started. So, he also one of the members in the Disaster Management Authority when first it was constituted. And after that, he have been contributing in this area as an expert, as a consultant, and also as an advisor to many forums. I welcome Professor Menon. If you are here, already joined. Even if you are not here, I've introduced you, and so that the participant who would come, they would know that you are there. And then we have Muzaffar Ahmad Saab, and who belongs to Kashmir, and he was there as the Director General of Health Services. And today we are talking about the COVID-19. So it goes very well with us that we have a panelist who represent the, and he has also been the member of the National Disaster Authority. A long contribution in the health sector and the emergency trauma center. When the All India Institute of Medical Science was working on the setting up the trauma center, he was instrumental in it, and also helping many state government in setting up the emergency kind of a setup system. So I am very happy and glad to welcome all of you on behalf of the Executive Director of NIDM and also on behalf of the National Institute of Disaster Management and also Child-Centric DRR for having this very, very important this deliberations on risk communication or emergency communication when we talk about disaster management, especially in the time of COVID-19. As Dr. Raka has already given definition, what we understand by that communication, I always say that communication is a relationship. It's not giving, just giving information is enough in completing the cycle. It's also that the recipient side who understands this communication well. So it is a two-way process. One is giving, the other is receiving, and the third is again going back to the this giver of information, that whether the person has understood it properly or not. And in the disaster management, especially when we talk about this, what should be the communication when we have a kind of a explosion of media in terms of the methods. We talk about print media, we talk about electronic media, we talk about social media, we talk about local media, we talk about theaters. All are being used differently at a point of time. With the pre-disaster, they have a different kind of a communication pattern in the disaster management. During disaster, when the disaster is there and already like COVID-19 is already there. And we have been struggling with the COVID-19 long and almost 7-8 months, and still it will very uncertain that how long it will go. So this is the duration and what kind of a communication which we are using in informing and educating people. And third would be then when post-disaster, when we talk about recovery from the COVID-19. So this is a classic case, and when we say that Honorable Prime Minister has to come and saying that it has to reach every individual, and we say that this is related to what communication is given is related to the behavior of the person. And if behavior is not changing, means that communication is not actually fully received or ignored. So we assume that communication receiving behavior is a rational choice. If somebody is facing some threat, that they will try to save themselves. This is what we say as a rational behavior. But at times when we see the visuals, we see that largely irrational behavior, and irrational behavior that people are directly confronting with the COVID-19 without any using, without any arms they are loaded with. They do not have masks, they do not have the sanitizing practices, they are not having the social distancing. So whatever the communication is starting or being given from the WHO to the highest authority of the National Disaster Authority, the regular press briefing from the Ministry of Health, and similarly that national and the state level, large number of people are sharing the social media and all. And although many fake news are also coming. So two-way. I will be taking up the question first on the communication, then I will be talking about this emergency communication and fake news during the disaster scenario also. So this is the whole background what Dr. Raka has mentioned, and also I have supplemented to what initiated. So I would invite first Shri Anil Sinha Saab, who has been at the helm of affairs, as I mentioned earlier, and also seeing COVID-19, and as the vice chairman of BSDM at the state level, what kind of a mechanism works when it is given, information is given, and what is ideally suited. So what kind of a gaps which we see, and whether we have been able to disseminate or we have not been able to use proper communication facilities which we have today, or there is a still gap. So Shri Anil Kumar Sinha, former vice chairman of Bihar State Design.
So, sir, kindly, if you allow me, let me introduce Anil Kumar Sinha, sir, and to the participants actually. Or
Yeah.
should
Sir, so let him speak.
okay,
Or
sir.
to say something. Okay, go ahead.
I just wanted to tell that all the participants, and Sri Anil Kumar Sinha, he is the former vice chairman of Bihar State of Disaster Management Authority in the rank of status of cabinet minister, and he established the ethos of the organization, lending its vision, goal, and leadership. Mr. Sinha has extensive expertise and knowledge relating to disaster risk reduction, including issues of environment and climate change with public policy analysis and programming. As Joint Secretary in charge of disaster management in Government of India, Sri Sinha handled major disasters as Odisha Super Cyclone 1999, Gujarat earthquake of 2001, and others. He was also a member secretary of High Power Committee on Disaster Management set up in the behest of the then Prime Minister. And earlier, he founded National Institute of Disaster Management, Government of India at the national level, and International Recovery Platform (IRP) UNDP in Kobe, Japan, at the global level. In recognition of his exemplary services, he was handed over key to the city of Kobe on behalf of Governor of Hyogo Prefecture in Japan. So, Sri Sinha sir, you are most welcome. Kindly enlighten us with your views.
Okay. Namaste to everyone and good afternoon. Thank you, Professor Santosh Kumar, for introducing me and for your, words setting the tone of the discussion. Thank you, Dr. Raka, for introducing me and saying some very kind words. Namaste, especially to co-panelist, our senior colleague, Shri Kem Singh ji, and namaste to Vinod Menon in case he's there, and Muzaffar Ahmed Saab if he's there. I'm very happy and that this discussion has been organized, this initiative taken by NIDM, and this is very timely, as I would say. And I'm thankful that I've been invited to participate in this. I will say a few things in three parts. First will be some general, context about the COVID-19 2019. The second is about the early and effective risk communication, the importance of that. And third will be moving the people, the society from a state of vulnerability to a state of resilience, you see. Now, as far as the first one, COVID 2019 is concerned, you may be surprised. I've twice mentioned COVID 2019. But let me make a special, mention of this and a request to NIDM, you see. One is that, I personally feel, and I've thought over it and mentioned it a couple of times, that when we say COVID-19, to me and to several other people I have interacted, it gives an idea as if there was COVID-18 also and there was COVID-17 also, 19, 18, 17 are like serial numbers, you see. And as far as this COVID is concerned, we have already seen it's going to be nearly a year in a month or so. And still the whole thing is totally alive, we are still struggling. We are still struggling, we are not yet in kind of grip of the whole situation, you see. So what I am saying is that this is going to be a long haul. And in any case, this COVID will be talked about in a very long-term time perspective, which may be 50 years to 100 years. Like we talk of World War II, World War One, etc. also. So imagine after 50 years or 100 years, COVID-19 would certainly mean as if there was COVID-18 and 17. But if we call it COVID 2019, 2019 will almost never be taken as a serial number. You see. And I am requesting NIDM to kindly take note of it. If possible, make a representation to WHO. It is never too late, to change this. I will also do my bit, you see. The second is the use of certain terms like social distancing. I do not know where it came from, but I don't think in our country or anywhere else we are really talking of social distancing. We are talking of physical distancing on a social kind of a setting, you see, but it is basically physical distancing. In our country, social distancing can have various connotations which may not be very pleasant. So that is also a correction which we need. And I would say it is not too late. Let us do it even now so that in the pages of history, it doesn't go as social distancing. It should go as physical distancing. So whatever protocols are there, we talk of, uh, mask being used and then sanitizer, hand sanitizers, etc., being used, and physical distancing, you see. So that point initially made, let me proceed ahead, that this corona or COVID has been such an unprecedented kind of a pandemic, a event, disaster event, which was perhaps never imagined and never happened. And I hope it doesn't happen again, you see. I really hope that it goes away rather soon than what is being projected. And we are back to a better, a better kind of a situation. It happened all too suddenly, you see, and it happened on such a huge scale all over the world that before anyone knew, you see, there were bits of news, in the beginning of this year, you see, January, February, March, you see, and January, February, and by the time of Holi coming, somehow there was a situation of caution. And I remember that we didn't play Holi the way we played it in the previous years, you see. And within no time, we got into the severe, situations of lockdown, etc., happening all over the country. And there was a fearful, world emerged out of this, you see. And even now, the whole world is fearful, and which is frustrated by, there's a sense of global frustration at all levels, you see, by serious disruption of public health measures, you see, and practically every aspect of life. This one pandemic has not left any aspect of life which is unaffected, you see. In the last 6 months or so, if one has followed news, I've been reading newspapers. There is no page in this, and there is no news, whether it is relating to sports or relating to economy or relating to social or relating to political life. You see, you think of anything, whether elections have taken place or whether any social, events are there, or economically, we know how it has devastated the economies all across the world, and even sports. So there's just no aspect of life at individual level, social level, and national, global level, which has been unaffected by this. And this thing has had immense social and economic impacts, you see, all over the world. You see, the lockdowns led to unprecedented kind of situation again, in terms of millions and millions of people, migrating from one part of the other, whether they were workers or others and all that, you see, terrible situations which really came about that. But then one thing is there, that of course this happened in a with very negative kind of devastating psychological effect. You see, the moment you hear someone getting affected by this, becoming positive. I mean, it's such an irony that becoming positive is the most negative kind of a thing happening today. You see, if you say I have become positive, I mean, it's the most negative thing which you are telling about yourself. That is also one of the very strange kind of a dimension which has emerged, you see. Then the economies all over the world, the best of governments, the strongest of economies across the world, you see, they have been practically, humiliated, they have been frustrated, and people do not know. Globally, still there are uncertainties. We don't really have clarity. Different governments, like US or China or Europe, etc., they are still struggling with the kind of a situation. There has been ups and downs, surge of this second wave, third wave, etc., etc. That has been the kind of a thing. But at the same time, many positive things have also happened, you see. We are back to realization that, look, public health measures in a public setting and individual level, you see. Health is a very important thing in life. That is what we have now realized, you see. Whatever be it, better attend to health, you see. Then there are things like, a lot of values have been, like we Indians, we have been again reminded that, look, it is much better to greet like this, etc., etc. And there are many lessons to learn, you see. You see, Winston Churchill once said, I would recall, that never waste a crisis, you see. And I think that is very, very important. And I think we haven't wasted the crisis. Globally and nationally, we have learned a lot of lessons. In fact, I think India, with all our Prime Minister's Atmanirbhar, movement, I would say, and then Jan Andolan, and local, vocal for local, and same things like that. I suppose it's been time when youngsters have taken to innovations. Any number of innovations, if we can have a separate session on innovation, I think there are dozens of innovations which have come about, very imaginative, very creative, about which we know to. In fact, that is something about which communication needs to be, engaged into, so that people know that these are the kinds of things, Now, in this setting, you see, this is in general about the COVID-19, 2019. Then the second part is about early and effective risk communication. And let me say that SFDRR, Sendai Framework for Disaster Risk Reduction, I think one of the key things, there are many important things in that, is understanding risk. You see, that is the first priority. You must know your risk, because only when you know your risk, that is the first step towards any mitigation or prevention, you see. So I think that is very important. And since Professor Santosh Kumar asked me what we did in Bihar, so let me just share my experience as far as the Bihar days were concerned, is that, you see, public awareness and education I connected it to understanding risk and know your risk, you see. That unless until I individually or you, every one of you, who is there, or the society knows about a risk, if I do not know or you do not know about a risk which is around me, which is behind me, what is the mitigation step that I can take? What is the prevention that I can do? Nothing whatsoever. Therefore, knowing the risk is the first step towards prevention or the mitigation, you see. But then what is knowing the risk, you see? Understanding risk. I think that one has to understand what is understanding risk, you see. And it does not end just with knowing the name of the risk, you see. One has to know how serious. One has to analyze, if there is, say, earthquake. In Bihar, when we were communicating about earthquake, then the communication which was going to the northern districts, you see, on the border of Nepal, that was different than the communication which was going to the middle portion of Bihar and the rest of Bihar, because the northern portion is in zone 5. They are highly vulnerable, you see. The impact of any earthquake activity will be far more serious over there than in the middle Bihar, and much lesser in the southern part of Bihar, you see. Same with floods, same with any other, disaster event which could take place, you see. So therefore, we engaged very intensively into this whole business of public awareness and education. And we started, when the International Day for Disaster Risk Reduction came, then we said, you see, high-powered committee had identified 34 disasters in five categories, you see. Water and climate-related disasters was one category. The second was geological disasters. Third was nuclear, biological, chemical. Fourth was accident-related disasters. And fifth was epidemic-related disasters, you see. So we had 34 then. Now we have, with lightning, etc., many more. It's almost moving towards 40, you see. So what I understand is that any state would, at any point of time, would have maybe half a dozen to a dozen disasters, you see. Now, how do you communicate any message about half a dozen to dozen different disasters to people on one single day, that is International Day for Disaster Risk Reduction or National Day? And therefore, we innovated, and we said, no, for the individual disasters, we'll have individual days, and we ended up with weeks. So we have Earthquake Safety Week in Bihar, we have Road Safety. It was there earlier, but we strengthened it. We have Fire Safety, you see, then we have Flood Safety Week. And finally, we came to, you see, School Safety Fortnight, you see. So that is what, Professor Santosh Kumar, we engaged into, and we did activities not just at Patna. More so, there was tremendous emphasis on doing activities involving school children, especially involving panchayats, involving local municipal bodies, etc. And all these, you see, into understanding, creating awareness about the disasters and all that, you see, because that is very, very important. So that were one good practice which I found during COVID 2019 was that the Joint Secretary of Ministry of Health and Family Welfare was every day initially for several months was giving the briefing personally. Later on, when there was a change, then the secretary, he started giving it himself, you see, which is a very good practice, you see. Then let me come to the third part and end. What I have to say is that vulnerability to resilience, you see. Professor Santosh Kumar talked about media mix. You see, now media is literally into our drawing rooms, our bedrooms, and media is literally into our palms. Every moment with WhatsApp and with all kinds of social media, media is right here, you see. So I think it is very, very important that we recognize the power of all kinds of media, including the radio, including the community radio, you see, because this may still be by and large an urban setting. Though that may not be true, many people will say that millions of people in the rural areas are using media. That's very good, you see. But then I think there is a power of, the traditional radio because of its penetration and coverage, and that is why it is being used in the Man Ki Baat. So I think that is very, very important. And I think, these things, media, then message, reaching out to the people, etc., must be done to tell people that, look, there is a state of vulnerability in which we exist, you see, all of us. And if we are informed about if we are informed and risk informed, and we understand the risk around us, and we strategize and we plan accordingly, then we can move towards a state of resilience, you see. So I think maybe I'm looking at the time, so I'm sure there will be another round of discussion. So I'll stop at this point so that I will also like to hear the other eminent panelists, Mr. K.M. Singh. I can see that Professor Vinod Chand Menon has joined, and Mr. Ahmed Saab has joined. So I'd like to hear, and maybe if time permits, I'll come back later. Thank you so much once again.
Thank you very much.
Yes, Santosh sir. Yes, please go ahead.
It's a very, very classified and very interesting presentation in terms of how COVID-19 should be written as COVID-19. And it's people might get confused in times to come that whether 18 or 17 or other things were there. Social distancing in terms of physical distance, how that effectively we put to use. And social distancing should not be taken as a kind of a critique, what the Westerners or the WHO, they are using it. In India, we always call it a human being as a social animal. So we should behave as a social animal in terms of being very close to each other and live for each other and die for each other. That's what the kind of underlying thing which you have highlighted, sir. And also that the moment is a kind of a stigmatized kind of a entire process of treatment and process of identification. The moment you get identified as a positive, then whole negativities comes around. That also is coming, whether it's a home isolation or hospital isolation. And the way it has been created, like that, if you see that it has a larger demonstrative effect in terms of that person dies of this COVID-19 or dying out of COVID-19, they are taken as a kind of a most kind of a untouchables, as probably we have not been able to protect other citizens when we are having this cremation, right to cremate and right to kind of getting cremated is also not there as a person where the last fire is not there and taken by the system and taken off. So this has a very, very large impact on the minds of the people. And you especially mentioned about the other disaster scenario in Bihar example, the school and the week we have observed, and also the school children. Many kind of instances which you quoted, and you said that why not have innovations while quoting this Sendai framework for understanding risk. So it is very important that the role of radio in the whole of mix of the instruments of media or communication is very, very important. I would, we will come back to you, sir, after listening to Shri Kem Singh ji, and also welcoming Professor Menon that he has joined. Although I have introduced already, but he will be introduced once again when he will get the turn of his speaking. And Shri Kem Singh ji, the former honorable member and the recipient of Netaji Subhash Chandra Bose award which Government of India has confirmed, and see that how you look at emergency communication, what Mr. Sinha has mentioned in terms of identifying different course and highlighting the initiative of Bihar. And he also highlighted that press briefing by the Government of India on a regular basis as a kind of best practices. And since you have been the emergency communication to the respondents and also to the community who are getting evacuated at the time of crisis. So seeing this emergency communication during the COVID-19, how you see the distinction between the two? and how the agencies who are giving this kind of information be careful so that it should not create any kind of a confusion amongst the society, and how clarity could be maintained. Dr. Raka, if you wish to say something. And,
yes, sir. Thank you very much, sir. Thanks a lot. Sinha sir already told that information is the crux was information is power, and that is constantly changing as well. So how we have to be empowered actually in the changing information scenario. And along with that, let me introduce the participants about KM Singh sir. KM Singh sir is IPS retired, and he has served in the intelligence bureau for over 3 decades in the Indian High Commission, London, from 1996 to 2000, and also as Director General of Central Industrial Security Force from 2003 to 2005. And shortly after the retirement from his services, he was appointed as the founder member of the NDMA in 2005 with the status of Minister of State, where he served 2 tenures till 2014. And he is actually the father of NDRF. Let me tell you that because I was one of the key members when NDRF was being raised, and I have seen his how much painstaking efforts he has taken to that is how NDRF has reached today at such a level, National Disaster Response Force I'm talking about. And also he is the first recipient of Subhash Chandra Bose Apada Prabandhan Puraskar in 2020. And right now he is serving as Vice President of the Policy Perspectives Foundation, a Delhi-based think tank. They are actually engaged in a lot of policy level and research level things related to well-being of our society. So KM Singh sir, you are most welcome, and I'll request Sri Ranjanji to share the presentation of KM Singh sir on the screen. So thank you very much. KM Singh sir, you are on. You can unmute yourself, sir.
Thank you, Raka.
Yes.
While you put,
Yes,
I'll
sir.
begin my whatever I have to say. First of
Yes,
all,
sir. Yes.
thanks to Professor Santosh and Raka both for some good words. And I must compliment all members of NIDM, including Professor Santosh Kumar, for this initiative of having a webinar on a very, very relevant subject. And I'm also grateful to the NIDM for giving me this opportunity to be a part of this webinar. Just by way of introduction, this COVID-19 has not only taken entire world by surprise, but has forced the entire world and every country to adopt a new normal in their way-to-way life. One learns by experience. Now I say COVID-2019. Is that right, Anil Sinhaji? So this COVID-2019 has been a new learning experience for us. And it has changed the lifestyle of people, even the rural areas. Out of many positive things, one positive thing is that sense of hygiene, even in the rural areas, in an individual has improved. I always used to say earlier that when you go to the washroom, wash your hands, but don't touch the handle of the bathroom door that is infected. And wash your hand before taking food. People eat a glow, but now people leave aside before eating. People sanitizer, hand washing, not spitting. So sense of hygiene and public health has definitely improved. So COVID has been a new learning experience. But in this, it calls for the entire world and each country for an introspection to identify their shortcomings and lapses and be prepared for any such pandemic in future. Sri Anil Sinhaji mentioned in his very comprehensive and very macro level perspective, he mentioned that about SFDRR, Sendai framework, that understanding the risk. Now, gradually, the entire country, entire world is rewriting the risk involved with COVID to preparedness. Now, my subject is risk communication. And first of all, I'd like to mention why is risk communication important, particularly in the health epidemics. According to the International Health Regulation, communication is one of the 8 core principles of preparedness. COVID-19 being a novel disease, it has generated intense fear, misinformation, rumors, and thereby confusing authorities and people at large and everywhere, because it's a totally unknown thing. But in this situation of confusion, risk communication, proper risk communication can be very effective to fight the disease, to limit the impact, and ultimately save lives. So risk communication, sorry, I should have asked you to, so I'm on this slide. So risk communication should be an integral part of planning for risk management. Change. Next slide. Next slide, please. Yeah. Strategy. First and foremost, communication primarily the role of the concerned authorities at the national level or the state level. In actual practice, risk communication is an interdisciplinary teamwork with proper interagency coordination within the country and also globally, particularly with the countries affected by the pandemic. So, risk communication needs a proper analysis and reanalysis as the situation evolves, review, and change the strategy depending upon the requirements of the target group. But in risk communication, the most important thing is the communication, the community engagement. It's a two-way thing between authority and the community. And so community involvement is, if there in the risk communication, it will have greater acceptability. Another very important point is in this risk communication, the timing and methodology, repeat, timing and methodology of the risk communication. It has to be done in a very judicious manner so that it ensures adequate awareness among the stakeholders without creating any panic. And here I want to give an example because the communication, when I said timing and methodology is very important. The famous economist, Dr. Vijay Kelkar, in his book released last year named In Service of the Republic, he has mentioned that his communication of the government decisions fall under 2 categories. One is such communication, a strict confidentiality, and need not be shared with the people at large or general people. And second is where decision policy must be shared with everyone in time. And I will give from my side 2 examples. The decision of the government like nuclear explosion in 1998 or surgical strike in 2018. It has very significant bearing on national interest. And strict confidentiality in both these cases is very, very important. And it was done. But certain other issues, as Dr. Vijay Kelkar has mentioned, which has direct or indirect bearing on day-to-day life of the people, there must be total transparency in a democratic country so that people get prepared. Without trying to find fault, I would just like to mention that demonetization was one thing which took the entire country by surprise, and enormous hardship people had to face. If a 1 month time was given for the people with strict warning, probably things would have been different and economy would have been different. So similarly, probably because of lack of experience, lockdown 1, I think timing and methodology. I'm not trying to find fault. One is always wiser by hindsight, but we have to do the introspection. But the world was facing COVID toward the end of December in China, then January, India, from February, Europe, February, big way. So, but we had enough time, as Anil Sinha mentioned. By then, our country knew during the holy time. In fact, the President of India cancelled his holy celebration in the first week of March. I know CISF cancelled his celebration on 9th of March. So country knew what is going to be the impact. And the preparedness would have started by then. If by then in first or second week of March, people all over the country were told that you have 1 week time or 10 days time, go back to wherever you want to be, but after that there'll be complete lockdown. Be it for a common person, business person, the migrant labor, everybody, things would have been different, hardship would have been less. But suddenly on the probably 22nd March, in the evening, overnight, everybody was asked to remain wherever it is. And the country fails enormously. So this is why I'm saying that risk communication, the timing and methodology is very important, that people are not inconvenienced and there is no panic. So it's important that all relevant information relating to pandemic should be put in public domain in a transparent manner to let people have adequate time to prepare and meet the challenges. So that was my second point. Now, next is that important issue of establishing an effective. Next, change the slide. Yeah. Establishing an effective institutional risk communication system. Now, this is having an institutional risk communication system is a prerequisite for sharing information and also opinion, both internally within the government and externally with all its stakeholders. Now, this system of risk communication has to be institutionalized in a manner where everything is done in a structured manner. And here again, I would like to give an example. Functioning of the institutional risk management system. You must have seen in the media 2 days ago, there was a report of the Parliamentary Standing Committee on Health and Family Welfare on the subject of, quote, outbreak of COVID-19. This report is a very big report by the Parliamentary Standing Committee, and it has quoted the failure of National Center for Disease Control Integrated Disease Surveillance Program. It has quoted how it has failed. And let me tell you, it's not only this organization has failed, but as was being perceived, even WHO, which is a well-established institution, did not come up to the public expectation in dealing with COVID situation and alerting the countries well in time. So the Parliamentary Standing Committee, it has suggested that this National Center for Disease Control should start functioning in a more effective manner. So risk communication, this system should be a high-level center-led initiative with special working groups at center and state levels with clearly delineated tasks and responsibilities. In this context, it is equally important in a federal structure like ours that there is a proper coordination between the center and the state. And this, I must say, the COVID situation, by and large, there has been good coordination between center and state, barring a few exceptions. But that should be, it should be 100%, then only, because ultimately health is a state subject. Center has a wider perspective. They exchange information internationally also, different states also. So that is very important. Then next point in the risk communication is, please change the slide. Proactive dissemination of information. As far as risk communication is concerned, important to ensure effective dissemination of authentic information and measures taken by the government with utmost promptitude on real-time basis. This is very much required for effective containment measures. And this, the proactive dissemination information, should be a part of community engagement strategy so that it reaches at grassroots levels in a seamless manner. In any such communication, it is necessary to avoid any panic known, particularly for the corona warriors like healthcare personnel and security agency, etc. Any panic situation should be avoided also for business community and general people. The risk communication strategy should have a holistic approach, inviting the local level teams. They should be encouraged to promote healthcare education for people in general and susceptible persons in particular. Anish Sinha mentioned about public awareness and education. And this has to be very much a part of the risk communication strategy. And the local teams can do it, in going up to the Panchayati Raj institution level, can do it much better. Next, interagency emergency management coordination within government and partner agencies. Now here, when I'm talking on this point, I'm referring to the economic situation, not only in India, but all over the world. Any major pandemic has direct bearing on economic development. COVID-19 has led to economic collapse in almost all countries in the world. It has severely affected business sentiment, survival, and growth of various industries, and has led to large-scale unemployment. As such, inclusion of business community and partner government agencies like PSUs, etc., in the decision-making process would be relevant. Similarly, involvement of civil society organizations in containment measures would be very relevant. In order to ensure the entire risk communication and community engagement process being conducted in a structured manner, another very important issue is formulation and adoption of standing operating procedures delineating the role and responsibilities of various partners in the risk communication and community engagement response. Without a proper structured standing operation procedure, things always remain on ad hoc basis. Next. Next is information sharing and cooperation with the international community. In a pandemic like COVID-2019, next one. Yeah, no. Information sharing. Yeah. In a pandemic situation like COVID-19, it has hit the entire world. Therefore, enhancing exchange of information and cooperation with international community and agencies to address and control the epidemic must get due priority. Such exchange of information globally should include sharing of successful preparedness, response measures, and also the best practices. There's not even, otherwise in every disaster we say that sharing of best practices globally enhances the knowledge, experience of every country. So this is far more relevant in case of COVID. It would help in addressing the sharing of and globally sharing of experiences would help globally to address the critical gaps in knowledge in COVID-19 and would also help in promoting evidence-based decision-making process for effective risk communication. Next. And my last slide is role of media in risk communication. Sri Anil Sinhaji has already mentioned about it, and he has mentioned that about the power of media. Yes, it is. Today's world, in 21st century, media is all powerful. Not only print media and electronic media, but social media also, and local media also. It has the fastest reach to people, and therefore, all sections of people, including the government agencies, many of the government agencies rely heavily on this media to get the latest information. Quite often, media tends to sensationalize a situation, and such sensationalization create a panic situation. So this is one thing. Sensationalization of a situation because of media, even social media, is one thing which the government has to take due note of. And for this, in the risk communication strategy, the authority has to take care of two things. Firstly, to use media as an important tool to disseminate authentic information of government agencies to all these stakeholders. And secondly, is to quell any mischief, misinformation, or mongering. That situation is not created. Thank you very much. I have taken a lot of time. And now, if there need be, as I mentioned, we'll revert back again. Thank you.
Thank you very much, sir, for giving a very, very kind of new narratives when we talk about this media and communication, especially when you said that engagement of community and how this engagement of community could be brought in different strategies involving everyone. And you did refer about the Parliamentary Standing Committee, this directions on especially the control of and the surveillance of the communicable diseases, and some directions that how the central led agency lead to a kind of find a kind of a mechanism where the state agencies and the local agencies along with the community should play a very, very vital and crucial role. And you did also reflect upon these uncertainties. Like in this particular case, COVID-19, even today it is still uncertain that how, what kind of a behavior because of its mutation process. And also that community are also not getting attuned with their own behavior despite several months have passed. very effectively, things have been put at Sri Anil Sinha Sahab also mentioned about that, the government regular briefing. You also highlighted and appreciated the government initiative regarding informing people. But still, you also focus on that, that we should have a kind of a very planned kind of a decision where the people should be informed in a much more transparent manner, so that this kind of inconvenience is avoided. But here I just, as a kind of, I would throw this light, also throw this question to Professor Menon, the point which you have brought in terms of uncertainties. And this uncertainties doesn't give this kind of a leverage to the agencies who are dealing with the kind of media, that how this COVID-19 would behave. However, in the going through the 6 or 7 kind of a months, capture some kind of that how it works. So, you have been writing on various social media on your anger. We have also seen on that, and you have been in the position also in the government as a NDMA, National Disaster Management Authority, and you are looking into the project of earthquake and also community engagement. So I would show with this question where this Mr. Kem Singh ji has left, and he talked about this, how social media can be brought holistically in the framework of whether we talk about Facebook, Google, WhatsApp, or any other means of communication where the communities are playing a much larger role than the government, and their things flows very high. And but he also mentioned about that we should be abstaining ourselves in terms of creating confusion. So, Professor Menon, you would be starting with the response to this. But Dr. Aka, if you'd like to.
Sir, thank you very much. Let me introduce Professor Menon first of all. It's actually, sir, Professor Menon is an alumnus of Kerala University and Jawaharlal Nehru University. He has more than 34 years of working experience, of which more than 2 decades have been in the field of disaster risk reduction, climate change adaptation, and public policy analysis. He is one of the founder members of the National Disaster Management Authority with the status of Union Minister of State. Professor Menon right now is an independent consultant in the field of disaster risk reduction, climate change adaptation, and public policy analysis. And he has been a consultant to UNDP, UNICEF, UNSCAP, World Bank, Global Facility for Disaster Reduction and Recovery, GFDRR, and also ADPC, Asian Disaster Preparedness Center, Bangkok. So sir has written a lot of articles, and he is very vocal on social media, and a lot of co-edited and written books are in his bag actually. So Professor Menon, you are most welcome, so that you can share your views with all our participants here and the experts. So. You can unmute yourself, sir.
Yeah. I'm very grateful to the National Institute of Disaster Management for giving me this opportunity, and especially the Climate-Centered Disaster Risk Reduction Center in NIDM. And this topic is very important because it's on risk communication and community engagement in the fight against COVID-19. And so we need to really look at this, the role of risk communication. And it's very important because all of us, including all the stakeholder groups, have a role to play in risk communication. And the most important role is with the government. And NIDM being one of the arms of the government, with the Ministry of Home Affairs, I feel that actually this is an extremely important topic to basically create greater public awareness among the people about the COVID-19 and also about all other disaster risks which are happening, whether it is a cyclone Amphan or whether it is the floods which have been happening, or the locust attack which has actually happened all of a sudden, or the COVID and its implications and its second generation problems, the cascading effects. So I would like to make a presentation. Is it possible for me to share a screen? Can I share the screen? Yes. Are you able to see the screen?
Yes, Professor Menon.
Yeah, thank you very much. This is on risk communication and community engagement. And so I would like to basically bring this in the context of what India has been going through in the past 9 months since the first case of COVID-19 came to India on the 30th of January 2020. And we would need to really understand how the COVID-19, what have been the real timelines in terms of how things have changed in the COVID-19 story in the Indian context. We know that this COVID-19 has actually affected 217 countries in the world. And we are talking in terms of 59 million people affected all over the world in 217 countries. And with a total death of more than 1.39 million people. And in India, we have more than 9 million people affected, and then we have lost more than 1,33,773 people as per the official records. However, there is also this issue about the unofficial non-COVID deaths which have been getting reported, or the COVID deaths which have been reported as non-COVID deaths. So we need to also understand how some of these people, who were COVID positive, have been declared to be, dead due to pneumonia or cardiac arrest or any other causes which have been actually mentioned. If you really look at the global impact of COVID-19, you can see that this number which we're talking about, more than 58 million people, and the loss of more than 1.39 million people all over the world, and we see what is happening in India. In the Indian context, actually, there have been reports that 25% of the caseload of the COVID-19 in the US happened last month. In the current month of November, we are actually seeing, we are on the 23rd of November, and we are seeing 25% of the caseload has actually happened in the US during the month of November. Now, this is something very important for us to note because, the total number of people who have lost their life in the US is more than 261,000 people. So we need to understand that, the issues are changing. We also have the urban dynamics which is happening. We have now, 4 mega cities which have a large population. More than 10 million people will be actually staying in these cities by 2025. We have Mumbai, Delhi, Calcutta, and also Chennai coming up. And we also have several tier 2 cities which are also emerging as bigger conglomerations of urban population. Now, this actually, we need different types of communication to the people in mega cities. We have people in the middle class, upper middle class, and people who have access to mobile phones and smartphones, and television sets will be able to actually access communication through such messages. People with internet access, we have seen that when online communication was actually was announced for education, for opening schools and colleges, we saw the difficulties which people had in terms of accessing that, mainly because of lack of hardware and also because of lack of bandwidth and also data plans to basically observe and also undertake assignments and things to that. And we also have seen the unfortunate suicides which have happened in many cities, because even in Kerala, about 176 people in the age group between 12 to 18 committed suicide in a 3-month time frame. So we need to understand that these communication needs are different for different categories of people. Now, what is risk communication? Risk communication refers to the exchange of real-time information, advice, and opinions between experts and people facing threats to their health, economic, or social well-being. And the ultimate objective of risk communication is to enable people at risk to take informed decisions to protect themselves and their loved ones. So you need to identify the hazard, assess the risk, develop the policy, and implement the policy and evaluate the policy. And this has to be a continuous cycle. And this is a part of risk communication. Initially, people are in denial, and then you also have faced the problems of stigmatization when people are actually having the problems of, of basically looking at, the doctors and nurses who were working in COVID hospitals were being denied, the facilities of leasing houses. The doctors who died in COVID were also, prevented. The families were prevented from burying such bodies in the public cremation grounds and so on. And we also have people going through depression, fear, anxiety, avoidance, helplessness, hopelessness, withdrawal, and there is also a problem in terms of way in which people respond to these different disasters. You can see that there are large numbers of people who need psychosocial support and mental health care. And disaster risk management is the application of risk reduction policies and strategies to prevent the creation of new disaster risk, reduce the existing disaster risk, and manage the residual risk, and contribute to strengthening community resilience and reduce disaster loss and damage. This is from the UNDRR, the United Nations Disaster Risk Reduction and Recovery Initiative. And there is a famous quote from the head of UNDRR who said that no one is safe until we are all safe. All of us have to really be safe. And this way the disease has actually been spreading across countries show that there is a need for us to be extremely cautious in terms of the dissemination and the spread of this disease which is happening. And this is a quotation from Antonio Guterres, the Secretary General of the UN, when he said that disasters cost hundreds of billions of dollars, hitting the poorest countries disproportionately and pushing millions into poverty. And we must tackle disaster risk and leave a more resilient planet to future generations. So we're talking about risk communication, which is actually able to communicate the disaster risk to children in schools and colleges, and youth in colleges and universities, and also to senior citizens and elderly people, and to people who are actually going through terminally ill cancer or kidney dialysis or many other kind of health needs which are to be addressed. And we see that 2020 is with masks, and 2021 is expected to be with the vaccine. But we need to understand also that risk communication is also needed to create greater public awareness among the people for the vaccine. How will people accept it? What is the administration of the vaccine? And risk communication, ideal risk communication must be media agnostic. It must be across various media platforms, electronic media, print media, social media, and community radio and various other platforms, All India Radio, Doordarshan, and all television channels, even FM radios and community radio. All these have to be used, and it must be neutral to religion, caste, class, and gender. And it must be accessible to everybody, reliable, useful, actionable, acceptable, inclusive, and consistent, and understandable to the general public. And it must promote sustainable behavior patterns. This is very important. But however, we are also seeing a lot of mixed messages which are being communicated by the people in the government and also by the institutions. We have seen people talking about flattening the curve in April when we were still in the middle of the lockdown, and we had 5 lockdowns, from 1.0 to 5.0, and we had 5 unlockings, from 1.0 to 5.0, and we are still in the process of unlocking. So, but risk communication has to be very consistent, and it must be very clear, and it must be communicated properly, including the celebrities, opinion leaders, politicians. They all have to convey this through their own behaviors. And we have also a large numbers of migrants, the problems across countries, and we have seen that the people coming back, through the Vande Bharat mission flights, we've had the numbers, millions of people coming back. Then the total number of people in the Asia Pacific region is about 91 million migrant workers, and they are 1/3 of the global migrant workforce. And the impact of the employment losses for the migrant workers in the Asia Pacific region due to COVID is expected to be $31.4 billion to $54.3 billion in the Asia Pacific alone. And ADB, the Asian Development Bank, had given an estimation that the total impact of COVID-19 globally would be in the range of about 5.3 to 8.8 trillion dollars. 5.3 to 8.8 trillion dollars. And there is also remittance losses which are actually happening to many places, which will also affect people with special needs, differently able people, elderly people, allocation to income generation and employment generation, and also lead to curtailment of travel to home, plans of children's education, marriages, etc. Now, these are some of the issues which we need to understand. And how do we really communicate that? And what are the problems which people are faced because of the COVID-19? Impact of lockdown on lives and livelihoods, loss of jobs, salary cuts, partial payments, layoffs, and terminations. Work from home is a myth and reality. We need to accept that. There are very few people who will actually have the comfort of working from home. There are many people who will not be able to work from home. They will have to come out and then, work. Informal, unorganized sector people, vegetable vendors, fruit vendors, people who are actually working in laundry, working as watchmen, working as clerks, or, working as cooks and, security guards and so on. And impact on education, we mentioned also about that, impact on access to healthcare, social protection, food security, violence against women and children, depression, trauma, and suicidal tendencies. All these have to be communicated. We need a proper risk communication package. And the migrant workers leaving cities, we have seen what kind of problems which people went through. There are 3 reports prepared by the Stranded Workers Action Network, SWAN, and we should be able to go through that and understand the implications of that. And there has also been the reverse migration which has been happening from places like Bihar, Jharkhand, Chhattisgarh, and many other, Assam and the Northeast, and also from many other states. People have actually now started coming back, but then it is the problems of loss of lives and disruption of livelihoods has to be also addressed through effective risk communication. And we have seen that it must be inclusive. People of all categories, all classes have to be reached out. The children are going through a lot of trauma. And this being a child-centered disaster risk reduction center, I'm sure that, there are lots of initiatives which are being taken up, but then the problems of the children, even now, actually in many countries affected by the tsunami, the children, many children are actually even scared to use the flush in the toilets, and they say that, the flushing of the water tank in the toilets actually, it creates tension and stress in the minds of small children. Now we have to see that there are many issues which we need to see in terms of how, we have actually, the COVID has actually spread in the country. I would like to just show this very briefly. This is actually the trend in terms of how the COVID actually started from the 30th of January. The first case started, and we can actually see that Kerala is a case which has been talked about very much. And the number of cases in Kerala, even though the Kerala became the state which had the first case, Kerala also became the state with the highest caseload in the country. But then we saw that, within over less than 2 weeks, we saw the Kerala government bringing it under control through the health minister, Shailaja teacher and her team. We were able to see that Kerala was actually able to bring it down. And by the 10th of April, 25th March, when the lockdown started, we saw that Kerala was on the top, but then you can see Kerala coming down. And then we can see Maharashtra and Delhi coming up. And you can see that by the 10th of April, we've seen the change, and Kerala has come down from the first position to the 10th position. And now if you really see what is happening in Kerala now with the Vande Bharat mission flights and all that, we've also seen a large sudden explosion in the cases in Kerala, and the testing is happening, the treating is happening, but the transmission is also happening because of the Onam festival and because of the Diwali and many other festivals. And now with the Christmas and the winter onset, we are expecting that there will be a sudden explosion and spikes in the number of cases all over the country. And we have to be extremely careful about that. And that is where risk communication becomes extremely important. I would also mention that actually there's another presentation which goes up to September, and we can see that. And there is also a lot of doubt in terms of the efficacy of this data, the integrity of the data. A lot of people are actually also seeing that we have to be extremely transparent even about that. And interpreting numbers in COVID management, we have seen that suddenly, we have mentioned that India is actually, performing so well. We have 93% recovery rates, and our fatality rate is also very low. But when you really look at this in terms of how the effective caseload, we are actually talking about, we need to really look into the whole aspect of data management. And as Mr. Khem Singh said very rightly, we are not looking at the fault finding in the system, but the fact that there has been a system failure was very obvious. And we need to also do fact finding, because without fact finding, we will not be able to really do justice to this whole problem of managing disasters. And we all know who are the vulnerable sections. I don't need to go into that, but we have to really see that, the vulnerable migrant workers, the palliative care patients, elderly people, scheduled caste, scheduled tribe, OBC, Dalits and minorities, women-headed households, and abuse and trafficking of women and children. All this we need to understand. I would also request, because of shortage of time, I will not go into this, but I would request, all of you who are interested in understanding about the COVID management, the therapeutics and the clinical management, must look at this video from Dr. Mike Ryan, who is the head of WHO's epidemic response. On 14th March 2020, he came on a video in which he said, we have to be fast and we must have no regrets. You must be the first mover. The virus will always get you if you don't move quickly. If you need to be right before you move, you will never win. Perfection is the enemy of the good when it comes to emergency management. Very, very beautiful and profound words from an epidemiologist, who has actually handled the Ebola crisis in West Africa. And he mentioned speed trumps perfection. The problem in society at the moment, everyone is afraid of the consequences of error. The greatest error is not to move, to be paralyzed by the fear of failure. And we cannot afford to lose. And he says, we know this with great certainty. I would request you to kindly take a look at this video from Dr. Mike Ryan, head of the WHO. And inclusion as affirmative action, social inclusion, financial inclusion, physical inclusion, electoral inclusion, emotional inclusion, digital inclusion, and participation is extremely important in decision making. We need to involve the communities. And risk communication, we have seen that there is a current disease which is actually happened as an offshoot of COVID, is the infodemic. Infodemic is an explosion of information, of which some are accurate and some are not. And some are going through the social media, making it hard for people to find trustworthy and reliable guidance to make informed decisions. During COVID crisis, people have also been flooded with the misinformation and disinformation through social media by a lot of mindless forwards. And we need to really look at this. And I would just mention that there's a Lancet editorial saying COVID-19 is not a pandemic. And in that, the Lancet editor mentions that it is a syndemic. And what's a syndemic? Syndemic is a sequential and concurrent epidemics happening in several countries around the world. And we know that there are many kinds of fallouts of this COVID-19. We are not fully sure about how it is affecting people in terms of their own recovery, and we need to understand this very clearly. And risk communication is extremely important to create a confidence building measure among the communities. And the risk communication is also very important. Wrong information can be deadly, but we are not powerless. And let's pause and take time to verify facts before you share something online. This is a website called pledgetopause.org. We have to ask before you share anything, who made it, what is the source, where did it come from, why we sharing this, and when was it published. Many dated videos are going around. Many dated news reports are going around. We need to really see that it is authentic, it is current, it is contemporary, and then only we share this. And the Secretary General, just conclude in 2 minutes. The Secretary General of the UN said COVID-19 is the greatest challenge of our time, but we are not powerless. We must persevere and confront this crisis together, following the science and demonstrating unity, solidarity, and integrity. And there are many things which says take care before you share. Social media has to be responsible, and we must not share misinformation, because this can actually seriously harm those around you. We know about super spreader events, the kind of news which started coming out about super spreader events, and we have to be extremely careful about how we can contain this properly. About sharing, we must be extremely disciplined in terms of sharing information on the social media. When UN is 75, these are 4 pictures, 4 photographs which are actually released during the 75th anniversary of the United Nations, and saying about the kind of work which is needed to be done with elderly people, with saving biodiversity, with children, with elderly, the problems of the people with geriatrics and things like that. And conclude with this, because 9/11 has been something which is still haunting the memory of many of those people who've lost their dear ones. And COVID-19 is also like that. It has also hit the families. A lot of people have lost their very closest dear ones, and we must not allow this to continue without actually doing our bit. And risk communication is extremely important. I must compliment NIDM for conducting this workshop and webinar on this very important topic. And thank you very much for giving me this opportunity to be here. Thank you.
Thank you very much, Professor Menon. Share with care. That's what I would say, that what kind of information which we validate and we share. But importantly, you mentioned a couple of from the United Nations and Secretary General also. You mentioned that is not a pandemic, and probably the world is grappling the biggest loss to the economy that's ever happened in any disaster in the world. And second is this is also crossed the number of deaths. More than 10 lakhs of people have died across the globe, and in India too. We have crossed 1,25,000 people have already just perished in this COVID-19. I do not know what definition of pandemic would be there. The very important point which you are highlighting in terms of that, what kind of a system which we are adopting, and what are the things which are available globally, and where that community has a real kind of a central role in that. And in this trajectory of information, where that lot of explosion is coming from the private sector, the government agencies have a very limited kind of today's world, but they have the public policy, but they have a very limited kind of a vehicle to inform people. So largely depending on the private sector, whether it's a print media, whether it's electronic media, whether it's a social media, whether it's Facebook and all. So, and many information which are coming on the video that you said about that, mentioning and referring about the video to be seen by everyone. Many videos are also coming and saying that its posture is better, why posture is better, why drug is better, or maybe that at times it is also leading to the black marketing once the remdesivir came as a kind of a and then the whole that India too also started looking for the kind of that treatment. Plasma therapy was still is into dilemma, but still people are going for the plasma treatment. In this kind of a confusion, and where the government is also giving this information, then the images which you shown in the presentation, which is very, very kind of revealing many things, whether we did good or we did bad. But important thing which is coming as that those images are very, very kind of having a deep imprint in the minds of the people. So idea is that which particular thing is to be shown to the when we are engaging community, and large number of communities who are getting affected and all. And from your presentation, I'm taking the lead to for inviting Muzaffar Ahmad Saab. But thank you very much for giving those ideas and interestingly highlighting all those points. And compared with tsunami to now COVID-19, how the health people, because large number of people are getting, they're looking for communication. Large number of people, if I'm an MBBS and MD, I'm just having this good enough to say and give the public information that yes, I'm entitled to give this message to the people. I do not know how to be validated if I'm Dr. X, Dr. Y, and Dr. and this. I give this kind of a, this doctor gives this kind of an entitlement to share whatever I wish to say. I do not know whether it has been approved by the ICMR or the WHO or those kind of a thing, but it is into larger practice. So in this context, Muzaffar Ahmad Saab would highlight that what kind of a medical practitioner should give information to the community when we talks about risk communication and community engagement. What Mr. Menon said is for saving lives of the people and also the behavior of the people. So how that will go, and Dr. Raka, you like to introduce Professor?
Yes, sir. Yes. You rightly said, sir, that before inviting Muzaffar Ahmad, sir, information is constantly changing, and information is the power. That is the dichotomy, and where the risk communication actually involves and empathy and care with authenticity, dedication and commitment, competence and expertise, honesty, openness and resiliency, and timely release to information. All are the components. We listened the very detailed talk of Professor Menon, sir. Now Dr. Muzaffar Ahmad is here. Dr. Muzaffar, let me introduce him first before inviting him. Dr. Muzaffar is also a former member of NDMA, and he is an expert of public health and medical expert. He has extensive expertise in the field of medical preparedness, mass casualty management, chemical and industrial disaster management, community-based disaster management, uh, along with school and hospital safety and mitigations as well. Sir is having over 3 decades of experience in the field of medical expert and medical management, and he has handled actually a lot of disasters, including avalanches, landslides, tsunami, man-made strikes during blasts, grenade attacks, terrorist attacks, and yatra of Sri Amarnath ji, etc. So, sir, you are most welcome. You can share your views with us.
Thank you. Let me first thank the NIDM Executive Director, Professor Santosh Kumar, Dr. Kumar Raka for inviting me and giving me the opportunity to be part of this webinar, which is an important with regard to the risk communication, and my seniors, Shri Inil Sinha ji, KM Singh Saab, Professor Menon have elaborated the need for effective risk communication, and I would like to briefly say that the COVID-19 is not the first pandemic India has seen, and it will most certainly not be the last either. In fact, in an increasing globalized and rapidly urbanizing world, the risk of such outbreaks spreading quickly to all parts of the world is only becoming higher. So the need of the hour is to build a strong public health system that can prevent diseases, promote good health, and respond quickly to minimize loss of life when faced with an outbreak or epidemic of this magnitude. In the last few years, the Government of India took a number of steps to strengthen the public health system through the implementation of various programs and missions, including the National Health Mission and flagship programs of Swachh Bharat, and that also has an impact on human health as they help preventing diseases and
boost immunity to the community. So what else is really required to build a strong and adaptive public health system across India is that besides the spending and in the healthcare, while the central government is committed to enhance the funding for health to at least 2.5% of the GDP, which was part of the national health policy in 2017. But it's not only the government at the central level and the ministry, but also states have a crucial role to play in meeting the national health plans, expenditure, targets, as health is a state subject. And also, we also need to ensure that a large share of funds are also spent towards the preventive care, which is need of the hour. And also what we feel, there has not been a focal point for public health in the Ministry of Health, which now NIDI Aayog and even the Parliamentary Standing Committee has stressed that there is need to have a public health, focal public health, not only at the central level, but also at the state level. And these focal points should be responsible for uh, for performing the functions of not only disease surveillance, but also response and monitor and informing and also educating. And what we need, the risk communication at the time of such outbreaks, epidemics, or pandemics, as well as providing evidence for public health actions. And in order to be effective, the the state governments also are required to be legally empowered to enforce compliance from other public health authorities as well as citizens. Although this time even the ministry and the states have used largely the National Disaster Management Act in the pandemic, but what is really crucial is that we need to have a public health act which has been lying, the legislation which has been lying in before the parliament for last so many years. And even from the NDMA we were taking up with the ministry that there is need for having a strong public health act which will be not only taking care at the various hospitals, but also can take action against various people. Like suppose I give an example of harmful biomedical waste, although that is covered under the pollution control, but also they make the hospitals accountable, so the uh, surrounding areas don't become impacted and infected. It is also essential that our country has a dedicated public health cadre in the states with officials. They have to be trained not only in epidemiology, but also demography. They should be trained in biostatistics, social and behavioral sciences. And to a great extent, this cadre can be created by training existing personals in their necessary skill sets. And as we cannot have the vertical staff, additional staff, and we also need to have a program for effective training of our frontline workers and like ANMs, those who are regular, our cadre of pharmacists, our cadre of other paramedical workers, besides the accredited social health activists and also Anganwadi workers, which also is need. And also what is also required is that in the undergraduate and the graduate and postgraduate training, effective steps are taken for uh, giving the training with regard to the stress on biological disasters and also other disasters like the which even in the NDMA we made a committee and prepared a training module for graduates, postgraduates, and even for the teachers. And also, we also need to have the efforts for disease surveillance. Although country have integrated the IDSP integrated disease surveillance, but what is that surveillance has not proved effective, especially in the current situation. Because if we have a good effective surveillance, we can have the response will be also really good. So this requires also an adding the list of notifiable diseases which needs to be expanded. Along with also we need to take the steps for integrating all the health facilities, not only in the government sector, what we have been doing only the notifying, but also in the private sector, and also infrastructure for surveillance has to be improved. Besides, we also need to upgrade and improve our laboratory systems, their biosafety levels, and also we have to provide healthy behavior among peoples, what has been mentioned by the speaker, Professor Menon, and that this is important that we have uh, the mechanism where the risk communication can be uh, channelized in a proper way. And although in response to the COVID-19, the risk communication package was initially formulated by the WHO, as the health workers all over the globe were not even knowing and about the procedure, not only about the treatment protocols and procedures, but also how to protect themselves, about their personal protective equipment, about the infection control prevention, and even large number of uh, healthcare workers, doctors, nurses, they died in all over the world because they were aware, they took unaware, and they took the pandemic very lightly. So because of the high risk, the risk communication package had to be framed along with the toolkit, which was initiated by the WHO. But our Ministry of Health also, they tried their best to, in a timely manner and in the shortest possible time, they uh, sent the material to states so that not only about the protection but also about the treatment protocols was also disseminated to various places. Well, what has been mentioned by Professor Menon about the vulnerable group, children, those people who are visually or physically disabled, much work and some work was done by the UNICEF and their partners, and they developed a package and risk communication package. And what is really required is what is inclusive approach for the community, which is really uh, important. And what has been seen that in the last epidemics or pandemics, if we uh, mention about what happened, the strategies in Ebola, it's a known fact that WHO failed miserably in Ebola in the various countries, and it was an eye-opener, and even the World Bank and some countries, they came forward, and communication uh, was found that it was not done properly even in the uh, at the time of Ebola. But for when the question of Zika came, good work was done by some UN agencies, including the UNICEF. And what is really required is that communication for all hazards, including widespread public health emergencies, is developed in a proper way, and it should reach maximum number of people in timely manner, and whenever such an exigency or an emergency occurs, and how our media, both in the print as well as electronic, is geared up. They are trained well in advance. Although for the COVID-19 pandemic, Ministry of Health, Government of India developed a strategic approach right in the April 2020, and it was focused on 5 possible scenarios to deal with the pandemic, and importance of risk communication was recognized under each scenarios, and it was separate section was even devoted in strategic plan, which I remember was stressed by Ministry of Health and Family Welfare Department. And I must tell you that emergency risk communication is a very and critical component of public health emergency planning and response, which has been documented and worked by Center of Disease Control in Atlanta, and communication has always recognized as one of the important components of the public health response to an emergency, and it has also been recognized as an acknowledged, and also acknowledged as, especially in the environmental public health uh, epidemics, and also in large scale, when we talk about what has been mentioned about the tsunami, large scale natural disasters and health emergencies which threaten the physical and mental. What is really required is that effective strategies for health risk communication uh, is essential for protecting public health in the event of pandemics, and we should get a lesson from the COVID-19, and also now is the time that we plan for our future, and also the first step will be credible risk communication is to develop and deliver appropriately structured emergency messages, which has been mentioned by my predecessor speakers, and I need not to elaborate. And risk in the risk communication situation, accurate and timely information at all levels is critical in order to minimize unwanted and unforeseen social disruptions, economic consequences, and to maximize the effective outcome of the response. The messages should empower a community and individuals to take positive actions, and if they take positive actions, the problem of uh, mental health will be taken care, and they should know how to take care of themselves at the time of such situations. And let me tell you, communication is a massive task in relation to the emergency preparation. And when we talk, what has been mentioned about the vaccine program, which is going to be, which will take some time, and the scientific reports say that 90% of the vaccine in 90% of the population, it will be effective. So the role of masking, social distancing, hand washing shall have to be continued, for which we need effective communication and risk communication. And we also need to ensure that all our staff, workers, frontline workers, or the health workers, they take note of the lessons and prepare themselves for future and such situations which can occur. I thank you. Thank you very much.
Yes, sir.
Thank you very much for giving this Muzaffar Ahmad Saab, for giving a very, very kind of a challenging situation in terms of the medical communication, emergency communication, and also about the readiness of our own hospital and public healthcare system. And you did mention about this Public Health Act, and which is pending with the government in the parliament. So there is an absolutely information to the people that yes, there is a public act which is to be considered for public kind of a pandemic to be handled at the largest scale. You did mention that WHO and other all communication which were responsible initially, that could not yield that much of result what it was aimed to. So that is, and there are too many agencies who are floating communications, giving information to people even today. So that's what people are getting confused. Even in the health sector, people initially, the treating doctors did not know what is to be done. So this kind of a situation emerges, and then the service providers also take it as a kind of a loss. And many of the hospitals who are treating COVID patients, they do not also have this emergency information center to patients. Like those relatives, those who have admitted their patients in the hospital, they do not have any access to what is happening to their patients. And hospital also is not geared up to inform that people that what kind of a treatment is going on, no database, something that kind of a information system. But you did mention about this how this probably act can help in bringing the new protocol in the emergency communication. And I see also a lot of questions which have been raised by the participants. I would request Dr. Aka to kindly those questions, and we will
Yes, sir.
request panelists to respond to those questions.
Sir, sir, should I go questions one by one, or should I ask in
Just
one go? And
just pick up if anybody is interested to ask, they can ask. But just pick up, like say I see one question, which
okay,
is
there are a lot of questions I am putting in front of you, and those whoever want to answer that they can themselves choose, because it's not written that who will be answering the what question.
no, it doesn't matter. So one question which I would read out for the panelists and would like to have a reflection that is saying that differential impact of disaster on different people, COVID-19 especially, that how the different group of people can get informed that the information or communication is designed for different sectors in the country. Or have you ever thought think for the future as well? It's open question to the panelists. I would request each one of you can reflect upon this question. Is very good question by our participants. So maybe we can have Sri Anil Sinha, and then we move to another Sri Kem Singh ji, Mr. Menon, and then of course Muzaffar Ahmad Saab. Sinha
Yeah,
Saab.
Santoshi, can you please repeat the question? There was some break in the voice, you see.
They are saying that emergency communication, when disaster strikes differently, it has a differential impact on different social strata and also the age group. So how the emergency communications are also designed for the different age group or differential kind of a people so that they can receive and they can protect themselves when we are looking for appropriate behavior. So is this in the pipeline of the thinking, or was it practiced, or will it have is a future course?
Well, yes, I think yes, it is a very good question, as you said. You see, disasters affect a lot of people in a region or in the current pandemic. You see, worldwide, but then the impact, of course, is differential. You see, like we are seeing, here, elderly people they are getting more impacted. people in the youth age group, they're getting less impacted. Children are getting even less impacted. That is one kind of a differential age-wise. Then, area-wise, also you see. So I think when we talk of the communication strategy, it is very important. It is really very, very important and critical, because if we give the messages like one size fits all, that is not going to. The example which I gave, about earthquake in different regions, certain level of messaging can be common, but then certain other level of messaging has to be different, because the impact of earthquake in different, zones, zone 5, 4, 3 will be different. So there is no point in zone 3, if you are talking of the same kind of impact which is there in zone 5, then there is a mismatch, So similarly, if we are really talking of the current pandemic, whenever whichever organization is really trying to build and develop the communication strategy, I think this is a very important factor to be kept in mind, that for different age groups, different areas, different stakeholder groups also, the kind of messages which have to go to the frontline workers, the doctors, the nurses, the other paramedics, the kind of messages which have to go to people in the essential services. One of these speakers said about the myth of working from home and myth and reality, etc. That is the reality. It's. I don't think there is a myth and there is a reality. The reality is that certain jobs allow people to work from home, while the nature of certain other job is that you can't work from home. You got to. I mean, a police person can't really be working from home. A sanitary worker cannot be working from home. Similarly, the hospital frontline workers, etc. Drivers of buses and transport, etc., etc. So I mean, that is the kind of a differentiated reality. Reality is not one uniform kind of a one picture, painting the whole picture with just one brush. So I think when we design the communication strategy, we need to really be very careful about mapping out the differentials, depending on various factors, and various variables, and then designing the communication strategy. I think I would say it is not possible to go into more specifics right now. Thank you. I think we are not hearing you. We are not able to hear you. Yes.
Thank you very much, sir. It's a very good kind of a Bihar example. You tried for different section of people, a different communication system, different pattern. As like many of us, like Mr. Kem Singh was telling that we are sensationalizing the information also. So that sensation brings panic amongst the people, and a different set of people get affected differently by this kind of a sensational news. Children might not be looking at those that seriously, but of course, elder one might get affected differently. So I would have a perspective, like to have a perspective of Sri Kem Singh ji on this question, that how this kind of information system, when sensation is a part of the package of the information system.
So there are a lot many more questions. If you want me to continue with that, because your voice is breaking, sir.
Sri Kem Singh ji is responding, Raka.
No, I'm saying it's a very, very question.
Yeah.
It's a very challenging question. I agree with Anil Sinha ji. There cannot be a single formula. And if we are thinking in terms of target groups, then we have to do prioritization. Prioritization based on the vulnerability. And most vulnerable community, most vulnerable people, most vulnerable age group, they have to be prioritized. And our frontline workers have to be briefed accordingly. So a single formula cannot work on this. Thank you.
Thank you very much, sir. Single formula will not work. One size fit all will not work, and we have to design our strategy differently. So let us hear first Muzaffar Ahmad Saab, then we will request Vinod Menon. Sir Vinod Menon to react on this question because he would be giving medical perspective, and he highlighted various stata. Sri Muzaffar Ahmad sir.
I think what is really required is what has been the risk communication, and also if we talk about the, what was mentioned about the treatment protocols. Let me tell you, although ministry has issued the communication with regard to the treatment protocols based on the advice of the experts, but still in many states and even in Delhi, uh, some people are following the best practices adapted in Bangladesh, like ivermectin, which is the drug which is used for roundworm infections, along with doxycycline and others, which may not have been put by our protocol or by communicated by our ministry. Similarly, there are except the one drug, that's the dexamethasone, which was proved by the United Kingdom that it is effective in helping in reducing the mortality. The use of like plasma, many other drugs was, it is controversial. Some countries have adopted the use of plasma, some have not adopted. So, but what is really required in our country is a proper communication, and ultimately the risk that our people and the patients have to be helped. And what was mentioned that the number of patients who are admitted, their relations, they don't know about the outcome. And it's true that in some of the the mortality has been due to aggressive treatment, not following the standard treatment, which has also been reported in our country and in other countries as well. So risk communication for doctors is really important, and besides the dissemination of the proper treatment protocols, that I would like to add, which is
Thank
need of the hour. Thank you.
Thank you, sir, for giving this protocol and treatment. You are very much emphasizing both for the service providers and also people who are getting treated. Now, the question to Professor Menon, you are very much engaged in social media and how to regulate media when it comes to everybody comes with the solution and it try to share this and making this video or audio viral, and if it is not properly examined by ICMR or maybe the WHO standards, what is your take, Mr. Menon, in this kind of a communication with this question is coming up, and also saying that how to actually communicate and make a kind of reducing the spreading of the COVID-19. Still, can we go for aggressive media campaign in the terms of maybe you can say that Atmanirbhar or Jan Andolan can be very, very effective?
I think that actually, one thing which is very clear is that, there is a second wave and there is a third wave, which is actually happening in many countries, around the world. Spain announced a lockdown, and they said that this lockdown is going to continue till March 2021. Okay, and UK announced a lockdown for 1 month. And then, we also have France announcing 2 weeks, and then Germany announcing 4 weeks, and Italy is going to announce. And now in India, we have had, some states announcing night curfew and some states announcing lockdowns. We have to be consistent in the way in which, we are trying to contain this, because we cannot actually have, the containment cannot actually happen unless we are able to really insulate the infected person from the rest of the community. The transmission actually happens when somebody who is untested and infected will actually be infecting others. You must have heard about this, weddings which are happening, where one person actually who is infected attends as a guest, and then many others get infected. There have been instances when even the bride and the bridegroom have got infected, and then some have even lost their lives, unfortunately. Yesterday there was an announcement of there was a discussion about a wedding in Brooklyn with 7,000 guests. And obviously there was no physical distancing, there was no masks, and it was all in New York, in Brooklyn, a wedding with 7,000 guests. So containment is actually going to be a problem. So behavior change communication is important. And I would say that, for blind people, how do you communicate? For people who are deaf and dumb, how do you communicate? The National Institute of Speech and Hearing is actually now making it mandatory even for news bulletins to actually have people explaining it through non-verbal communication, so that people can actually understand. People who are deaf and dumb can actually also understand a message which is being given. That actually Stephen Hawking wrote the book by the twitch of his eyebrow. There was a software package which is actually helping him. There are a lot of people who are autistic, who are suffering from cerebral palsy or many other disabilities, actually are learning. The people with special needs are also learning. So we need to have systems which can actually communicate to those people. So I would suggest that we need to also make sure that institutions should send the messages without being inconsistent. We have seen inconsistency with some of the institutional messages which have been coming from ICMR and also from WHO and also from CDC. So this should be avoided, because it becomes difficult to correct something when you're actually making these kind of mid-course corrections and sending messages, because many people actually have been finding it difficult to say whether plasma therapy is advisable or not. Every day, I'm actually also supporting several requests for plasma therapy in many states, many districts in the country. And that is helping. That is helping people to recover. And we know that. Doctors know that. So I think, we have to be open to accepting different approaches which are successful in many cases. But at the same time, Dr. Muzaffar Ahmed will say that, if there is a patient who's actually having either a multiple organ failure or a cytokine storm, or losing oxygen and becoming breathless, that kind of a support system, whether the person should be on invasive ventilators or whether that person should be on oxygen through high flown nasal cannulas, those are the kind of decisions which have to be taken by the doctors. We should not actually be influencing those decisions. Relatives should not influence those decisions, or social media should not try to influence those decisions. Experts must be allowed to have their say. But unfortunately, we are not seeing that happening in many places. And I think we need to give the space to the professionals to perform. And that's my request.
Sir,
we're not able to hear you.
What I'm saying is filtering out of those information which are floating around through the social media and also the print and electronic media. I cannot say irresponsible, but without authenticating. So those kind of information one should refrain. And I don't know how to go about it, that you highlighted, and we are concerned about this international scenario again, the spike and the lockdown, which are still going into the kind of we thought that we are moving forward, but it's again coming backward. And again, it will affect somebody writing, whether it will lead to hunger, death, or somebody, it will happen again, kind of unemployment issues and challenges and so on and so forth. But idea is to how to come out with this kind of a situation, which is again, when we look at the television and the media and information comes from the Europe and other affected countries, we get affected. And we get bewildered that what kind of a challenges or things which we should take. So can I request the panel, because this is a very, very august panel which we have today, I can suggest an IDM as a takeaway, that 5 or 10 points which we can say that we can suggest it as a form of this government, that at this kind of a situation which is re-emerging in India, what has happened in Europe, or their festivals, elections and other things which happened, we also do not have the responsible behavior at the individual level. How we can rationalize our own behavior, and through the support of media, and how media can guide us in rationalizing our own behavior in fighting COVID-19. So probably that would be a very, very good help which we can share with the government also. I know that you are individually also writing to the government and giving this kind of a recommendations, but I'm sure the kind of suggestions which I have noted would certainly, like you said, that the 5-6 point which I can as a takeaway, which you can elaborate, that few things as a terminology which we are using, that has to be very precautiously we should be choosing, whether social distancing or COVID-19 or whatever. So one is this in terms of terminology, which can go down to the local level or the last mile. The second is that we still to be recognized these uncertainties, that uncertainties are floating and we do not know how that mutation will go, how the vaccine will flow. One side it is people are getting kind of a complacent that that 8 months we have observed. So now that herd immunity would work, and many things which are coming from the media. So the second point or third point which is coming as that how we can package our communication strategy. That is very important in a risk communication strategy, which can go as a kind of part of the recommendation. And what could be those strategies? That is very important. The third is that we are saying that how we can combining it with other disasters too. That side by side we are having other disasters, so that our information about COVID-19. This does not mean that we should neglect the other emergency communication. And the example of that Bihar and other places which Mr. Sinha has also gave, that is important. The fourth is also that sharing with caring, or care with share. So share with care also, that important. We should not start sharing and making all the videos and information viral. Then Public Health Act is very important to make responsible the health practices, whether the private sector or the public sector. The risk communication should be designed thoroughly, and that should also be a part and parcel of the disaster management and also public health emergency. So both cannot be read in isolation of each other, but should be thought of combining together for changing to the public behavior. And also that many of the actions which we are taking at the social media, and how to regulate or those information mechanism to filter out those could be very important. And another is that all information and strategies we are talking about should be inclusive, that how it should reach to autistic children, deaf and dumb children, the person with disabilities and all. So this is a broader framework. And in this broader framework which you have highlighted, I just 2 minutes, if any of the listeners want to add something before we close, that would be very nice. If any of the speakers would like to add on, and so that we can close. Please. Mr. Menon would like to say something. Professor Menon.
Yeah, I think that I would request, because the concept paper also talked about, what is the road ahead and what would be the kind of action steps which you would like to do. I would suggest NIDM to do, if possible, discuss with, the management and also with the Ministry of Home Affairs and NDMA, and see whether you could actually initiate a concurrent evaluation of the performances of states, to COVID-19. If that would actually be something which could actually understand the data integrity issues. We are seeing multiple platforms doing that. So that is one suggestion. And second is, the preparedness for reopening of schools and colleges and universities, would need to be understood carefully, because in Andhra Pradesh, we saw 260 students and 160 teachers got infected. In Maharashtra, we have 550 teachers getting infected and so on. So reopening of schools, colleges and universities, we need to have a program and a plan. And a modeling exercise is currently underway in covidtoday.in in looking at implications of that in specific states and specific districts. With the state governments, if there is any specific interest, we can actually do that. There's a group of epidemiologists, data scientists, and doctors trying to do this exercise. So that's second thing. And third is focused and targeted risk communication with specific needs of psychosocial support of various sections. That I think is extremely important. Migrant workers, informal sector, unorganized sector people, and elderly people who have not been getting their pensions and so on. So I think we need to have some specific focused interventions required. I think there is also a need for a clarification and a clarity on this message about herd immunity. I saw a news report which said that Pune has already got herd immunity because serosurveillance studies said 85% of the people who have been surveyed in 5, Prahags in Pune found 85% people had, antibodies. But that message is actually going to say that we already have developed the immunity, and so we can continue to be moving around. I think we need to be clear about messaging. That's important. And fourth area, which I think is extremely important, is for NIDM and NDMA and others to also look at a strategy for vaccine administration. I think an expert committee is working on that, and maybe you can think of giving some ideas into that. And the last point is also, what is the methodology for looking at tourism and hospitality industry, and many other sectors which are getting hit, very seriously. Is that some way of sending that message is needed? Thank you.
Very much, Mr. Menon. Kate Singh sir, anything would you like to say as a closing remark? Christina sir?
Yeah. Okay. Just 2-3 points.
Okay.
Sir, Kame Singh sir is coming, then please go ahead, sir.
Kame Singh sir.
Okay, then let me go ahead.
Yes.
You see, one is that, this talk being, this webinar being on this communication and engagement of the public, let me confine specifically to this, that a recommendation to the government that there has to be a risk communication plan, I think we have a national policy, I don't know that we have on the pandemic, but then if we have it, maybe it needs a relook. But a risk communication plan within the overall disaster management policy and the national disaster management plan. Obviously, as we have discussed, this communication is something which is very, very, very crucial, very important. It impacts the whole population, it impacts the behavior of the people, all those things. So therefore, it is too critical to have a risk communication plan. Obviously, it will address all these stakeholders. Obviously, it will address all the community. It should especially address the role by the children and by women, because, and then we should say that building resilience is an investment that will pay significant dividends into the future of everyone, I think last point which I had mentioned was vulnerability to resilience. I think that is the ultimate aim, So that we should say. And, beyond vulnerability, we can move towards resilience. And I will give one example, as to how local community level action helps, And that is why it must be promoted, because government cannot, should not and cannot afford to take the overall task. You got to encourage, and motivate and facilitate the communities taking action. Where I live, in Gurgaon, around 500 families are living, Now, it's a very well, touchwood, very well working kind of a society. We don't really have problems generally, so the governing body in the month of late March itself, they stepped back and they set up a apex committee to deal with the current pandemic, And then someone, found out that, well, there is one Mr. Anil Sinha, So they requested me, they said, sir, why don't you chair it? And after that, we held the meetings of the apex committee. We anticipated situations that in case, for certain months, we didn't have any case in our locality, But then we anticipated that supposing there is a case, what is the protocol going to be followed, And things like that. And then we suddenly had a case, you see. And then contact tracing, became one of the issues. Now, before the municipal corporation Gurgaon comes, we discovered that one of the ladies had done a course on contact tracing from John Hopkins, you see. And therefore, we requested that lady, she did this. And as soon as this news is spread, you see, then within 2 weeks or so, you see, 5, 7 people, residents, they did the course, because it is online course for 5 hours. You see. That increased the confidence level with our society to a great extent. So moving from vulnerability to resilience, because as now we have had, something like 40, 50 cases, but then we know how to deal with it. There is no panic. Fortunately, there has been no death till now. And the initial management, through the contact tracing, etc., and then by the local society management has been very, very smooth, you see. So we don't have to run, to the municipal corporation for everything. They will not be able to, in any case, help because they are under tremendous pressure. So therefore, I think, encouraging these community action, etc., is very, very important. One aspect which somehow or the other is very critical, but we have not discussed much, is relating to the economy, is relating to the livelihood. Migrant labor issue was mentioned, but we didn't discuss about MSMEs, you see. MSMEs are the backbone of the whole industrial, setup of the country and economic growth. You see, if there is one Maruti, there are thousands of MSMEs which are working behind it to maintain the supply chain management. You see. Now that is something which, in case we can give some specific ideas, because again, thousands and millions of people who have been displaced, but the economy has to go and now they are trying to come back. You see, how exactly, what is the kind of a plan? Because you see, in the initial stages, we saw that, you see, there was a lot of communication combined with deliberate misinformation, mischief making. There was malice and conspiracy theories were going around, and they multiplied, you see. That created a lot of confusion. So in case we have a clear-cut communication strategy and a plan, you know, addressing this segment of the society also, because ultimately if you are talking कि जान है तो जहान है, अगर जहान को आपको चलाना है तो इकोनॉमी को आपको चलाना है, अगर इकोनॉमी को चलाना है तो एमएसएमईज को आपको एड्रेस करना होगा, बिकॉज जो बड़ी इंडस्ट्रीज हैं, बिग इंडस्ट्री स्टार्ट, but it is these small different micro and the small and the medium for which we need to really have a clear-cut strategy. It needs to go out to all those millions of people who have gone back home. And in case they are not able to find a suitable livelihood over there, they need to come back. And after all, these skilled laborers are not developed just by one training program. You see, and that is why industries have been giving all kinds of incentives, even getting their skilled workers by flights, you see, spending on that. So I think this is one very important aspect of the whole communication strategy. Let me stop at this and maybe hear some others. Thank you so much. Yes, please, I am done.
Yes, thank you very much, sir. I think Santosh Kumar sir is having some internet issue at his end. So if Kem Singh sir, if you are online, if you want to say a few final words and recommendations. Kem Singh sir. I think Kem Singh sir is not able to listen us. So I'm receiving a call from KMS. Yes, sir. कोई बात नहीं है सर, मैं अभी अनाउंस कर देता हूँ. Kem sir is telling that he is also having some technical problems at his end. So Muzaffar Ahmad sir is here right now, sir. If you have any final words, sir. I think, sir, Muzaffar Ahmad sir is also now having some connection issues. So let me finally conclude here, sir, because we are almost past.
Yes.
time limits a lot. So thank you very much, Anil Sinha sir. Thank you very much, KM Singh sir. Thank you very much, Vinod Chandra Menon sir. And thank you very much, Muzaffar Ahmad sir. And we have taken care and duly noted down all your recommendations, and we will be developing a recommendation based on that, and we will certainly be forwarding that to the Ministry of Home Affairs and our headquarters. And at last but not the least, thank you very much all the participants for your wonderful questions, and you have very patiently listened us, and you have interacted with us. Interaction was something very wonderful. I was thinking that our participants would be completely engaged with that talks or not, but I can see that it's really wonderful. And don't be panicked about the certificates. We don't have any feedback links for that, but the system itself records everything, and the certificates will completely reach you at time. And along with that, sir, if you kindly allow us so that we can now end the session today.
Thank you very much, Dr. Kumar Raka. Thank you.
Thank you, sir. Thank you. Thanks.
Okay, thank you. Thank you so much. Bye. Thank you, Menon ji. Wonderful seeing you. We'll talk later.
Thank you.
Okay.
Thank you.
Bye-bye.